Her name was Maya Chen. Former Navy SEAL, intelligence specialist, and survivor of operations most civilians would never comprehend. He assumed she was defenseless. The shove came without warning, sending her stumbling backward in the sterile hospital corridor. He had no idea she possessed skills that could end careers, or lives, with surgical precision. She was about to dismantle a conspiracy that had poisoned the healthcare system for decades. As the threats multiplied and the cover-up deepened, Maya's training became her most lethal advantage. What happens when someone who's spent 20 years protecting others decides it's time to wage war on those who exploit the vulnerable? The fluorescent lights hummed overhead as Maya Chen adjusted her nurse's uniform in the employee parking garage. At 45, she maintained the lean physique of her SEAL days, though few at Sacred Heart Medical Center suspected her background. She'd traded combat boots for comfortable sneakers, but the situational awareness remained razor-sharp. The night shift at the trauma unit suited her perfectly. Chaos, pressure, life-or-death decisions, it felt familiar. She'd been working here for 5 years since retiring from the Navy, finding purpose in healing rather than warfare. Her colleagues knew her as the unflappable charge nurse who never lost her cool. Even during the worst emergencies, Maya walked through the hospital's main entrance, nodding to security guard Peterson. The emergency department buzzed with typical Friday night activity: overdoses, domestic violence cases, car accidents. She moved efficiently between patients, her trained eye catching details others missed. Around 2 a.m., during a brief lull, Maya stepped outside for fresh air. The loading dock area was poorly lit, isolated from the main hospital traffic. She was reviewing patient charts on her tablet when heavy footsteps approached from behind. Well. Working late again, sweetheart? Maya turned to face Dr. Richard Castellanos, the head of emergency medicine. His breath reeked of alcohol, his expensive suit wrinkled from whatever private party he'd attended. Castellanos had a reputation: brilliant surgeon, hospital politics player, and predator who used his position to exploit female staff. Dr. Castellanos. I didn't realize you were still here. Special board meeting, he slurred, moving closer than professional distance allowed. You know, Maya, you've been avoiding my invitations. That's not very collaborative of you. Maya maintained steady eye contact. I prefer to keep my relationships with colleagues strictly professional. Castellanos laughed, a harsh sound that echoed off the concrete walls. Professional? You're just a nurse, honey. I could make your life very easy here, or very difficult. Before Maya could respond, his hand shot out, grabbing her chest aggressively. Time you learned how things really work around here. The assault lasted mere seconds, but Maya's military training kicked in immediately. She could have broken his wrist, could have dropped him unconscious to the pavement. Instead, she stepped back, voice deadly calm. Remove your hand. Now. Castellanos laughed again, finally releasing her. Or what? You'll file a complaint? Good luck with that. I own half the board of directors. He straightened his tie mockingly. Remember your place, nurse. Maya watched him swagger back toward the main building, her hand steady despite the adrenaline surge. 20 years of combat experience had taught her patience, strategic thinking. This wasn't over, it was just beginning. The next morning, Maya sat in her modest downtown apartment, laptop open, secure phone beside her on the kitchen table. She'd spent hours documenting everything about the previous night's incident, but her investigation had revealed something far more disturbing. Using contacts from her intelligence background, she'd accessed personnel files, financial records, and internal communications that painted a horrifying picture. Castellanos wasn't just a predator, he was the center of a massive fraud operation. Medicaid billing irregularities, she muttered, scrolling through spreadsheets. Ghost procedures, unnecessary surgeries, kickbacks from pharmaceutical companies. But the sexual assault complaints were what made her blood boil. 17 different women over 6 years. Nurses, residents, even patients' family members. Every complaint had been investigated by hospital administration and quietly buried. The women had been transferred, demoted, or fired. Maya picked up her secure phone and dialed a number she hadn't used in 3 years. Rodriguez Consulting Services. Elena, it's Maya Chen. A pause, then excitement. Commander Chen. Jesus, it's been forever. You finally ready to come work for us? Elena Rodriguez had been Maya's intelligence analyst during their final deployment. Now she ran a private investigation firm specializing in corporate fraud. Maya had turned down multiple job offers, preferring the quiet satisfaction of nursing. But not anymore. I need a deep dive on a target. Medical fraud, sexual assault cover-ups, potential corruption reaching into city government. Send me everything. This sounds like our kind of case. Within 48 hours, Elena's research revealed the full scope of the conspiracy. Castellanos was connected to Mayor Patricia Hoffman through a web of political donations and business partnerships. The mayor's husband owned a medical supply company that had received millions in no-bid contracts from Sacred Heart. More damning was the connection to Phoenix Healthcare Management, a private equity firm that had been systematically buying up hospitals across the region. They specialized in cost-cutting measures that prioritized profits over patient care, often leading to preventable deaths. Maya studied the financial flows, the shell companies, the carefully hidden connections. This wasn't just about one predatory doctor, it was about an entire system designed to exploit both patients and healthcare workers. That evening, Maya returned to work as if nothing had changed. She smiled at colleagues, treated patients with her usual competence, and avoided Castellanos when possible. But she was gathering intelligence with every interaction. In the break room, she overheard residents complaining about pressure to order unnecessary tests. In the pharmacy, she noticed discrepancies between what was ordered and what was billed. In administration, she observed the nervous behavior of financial staff who seemed to be hiding something. 3 days into her investigation, the intimidation began. Maya's car tires were slashed in the hospital parking garage. Her apartment mailbox was vandalized. Anonymous threatening messages appeared on her personal phone. Someone had broken into her locker at work, though nothing was stolen, just a message that they could reach her anywhere. But the final straw came when she arrived at work to find her schedule had been changed. Instead of the trauma unit where she excelled, she'd been reassigned to the pediatric ward. Castellanos' way of showing his power. Maya didn't protest. She simply smiled at the supervising nurse and accepted the assignment. Let them think they were winning. That night, she activated a network she'd hoped never to use again. The coffee shop in Georgetown looked ordinary, busy professionals, students with laptops, the usual urban mix. Maya sat in a corner booth, watching the entrance. At exactly 3 p.m., a woman in a Navy business suit approached. Maya? Sarah. Thank you for coming. Sarah Wu had been Maya's handler during classified operations. Now she worked for the Department of Health and Human Services, investigating healthcare fraud. They'd remained friends through the years, though they rarely met in person. I reviewed the materials Elena sent, Sarah said quietly. This is bigger than just Sacred Heart. Phoenix Healthcare Management has been using the same playbook in 12 different cities. The fraud totals are in the hundreds of millions. And the sexual assault cover-ups? Part of the same system. Keep employees afraid, isolated, dependent on the institution for their livelihood. Classic organizational control. Sarah leaned forward. We've been building a case for 2 years, but we needed someone on the inside. Someone expendable, you mean? Someone with your specific skill set. Maya, if you're willing to do this, we can bring down the entire network. But it means going deeper undercover, and the risks. Maya thought of the 17 women whose complaints had been buried. Of the patients who died from unnecessary procedures. Of the residents being pressured to compromise their medical ethics. What do you need me to do? The plan was elegant in its simplicity. Maya would continue working at Sacred Heart, but now she'd be wearing a wire in documenting everything. Elena's firm would provide technical support, Sarah's federal task force would handle the legal framework, and Maya would be the key witness who could tie it all together. For 3 weeks, Maya gathered evidence. She recorded conversations where Castellanos bragged about his political connections. She documented the fake billing procedures that administrators thought no one noticed. She befriended other staff members who'd been victimized and convinced them to share their stories, but the breakthrough came when she gained access to Castellanos' office computer. During a late-night shift, Maya volunteered to deliver patient files to the executive floor. The building was nearly empty. Security cameras had blind spots she'd mapped weeks ago, and her Navy training had included skills most people never imagined a nurse might possess. The office lock took her less than 90 seconds to bypass. Castellanos' computer required another 5 minutes. Sloppy password security for someone involved in such extensive criminal activity. What she found exceeded even her worst expectations. Email chains detailing how to pressure female staff into sexual compliance. Financial records showing systematic theft from Medicare and Medicaid programs. Meeting notes discussing how to eliminate problematic employees who asked too many questions. Most horrifying were the patient files, cases where Castellanos had deliberately prolonged treatments, ordered unnecessary surgeries, even withheld critical care to maximize billing opportunities. Maya downloaded everything onto encrypted drives, her hands steady despite the magnitude of what she was uncovering. 20 years of military service had exposed her to human evil before, but this felt particularly obscene. Using healing as a weapon. As she prepared to leave, footsteps echoed in the hallway outside. Maya moved swiftly, shutting down the computer and returning everything to its original position. The footsteps grew closer. She slipped behind the office door just as it opened. Need to accelerate the timeline, Castellanos was saying into his phone. The federal audit is scheduled for next month, and if they find, he stopped mid-sentence, scanning the room. Maya held her breath, pressed against the wall in the narrow space behind the door. After what felt like hours but was probably 30 seconds, Castellanos completed his call and left. Maya waited another 10 minutes before emerging, her heart rate finally returning to normal. She had what she needed. Now came the dangerous part. The federal task force moved with military precision. At dawn on a Tuesday morning, agents simultaneously raided Sacred Heart Medical Center, Phoenix Healthcare Management's regional office, and Mayor Hoffman's campaign headquarters. Maya watched from the hospital parking garage as boxes of evidence were loaded into federal vehicles. Castellanos was led away in handcuffs, his usual arrogance replaced by panicked confusion. But the victory felt hollow when she saw the news coverage that evening. Respected physician arrested in healthcare fraud investigation, the anchor reported. Dr. Richard Castellanos, who has served the community for over 15 years, maintains his innocence in what his attorney calls a politically motivated witch hunt. No mention of the sexual assaults. No recognition of the victims who'd suffered in silence. The media narrative focused entirely on financial crimes, as if the human cost was irrelevant. Maya's phone rang. Elena's voice was tight with anger. They're spinning this as a rogue doctor story, making it sound like Castellanos was acting alone. What about Phoenix Healthcare Management? Minor fines, no criminal charges. They're claiming they had no knowledge of Castellanos' individual actions. Elena paused. Maya, I think they're going to try to make you the fall guy. Paint you as a disgruntled employee who fabricated evidence. Within hours, Maya's prediction proved accurate. Anonymous sources told reporters about her unstable military background, her vendetta against hospital management, her suspicious access to confidential information. Castellanos' high-powered legal team painted him as the victim of an elaborate frame job orchestrated by a dangerous former soldier who couldn't adjust to civilian life. But Maya had learned patience during her Navy years. She'd also learned that sometimes you have to lose a battle to win the war. 6 months later, Maya stood before a packed congressional hearing room. The witness table felt familiar. She'd testified before military tribunals during her career, though never under such intense media scrutiny. Thank you for your service, Commander Chen, the committee chairwoman began. Can you tell us what initially motivated you to investigate Sacred Heart Medical Center? Maya's voice was steady, professional. I witnessed a sexual assault committed by Dr. Castellanos against my person. When I researched his background, I discovered a pattern of similar attacks that had been systematically covered up by hospital administration. The room fell silent as she described that night in the loading dock, the evidence she'd gathered, the network of corruption she'd uncovered. Her testimony was clinical, detailed, unshakable. Then came the moment that changed everything. The committee played a video recording, security footage Elena's team had recovered from a damaged server at Sacred Heart. It showed Castellanos assaulting Maya exactly as she'd described, but it also captured audio of their conversation. You'll file a complaint? Good luck with that. I own half the board of directors. The footage continued, showing Castellanos making similar attacks on other women over several months. The hospital's own security system had documented everything, but administration had buried the recordings. The courtroom erupted in chaos. Cameras swung toward Maya, but her expression remained composed. She'd known this moment would come. Elena's technical expertise had eventually recovered the deleted files. By evening, the story had exploded across national media. Not just another healthcare fraud case, but a systematic pattern of sexual assault enabled by institutional corruption. Within a week, 17 women had come forward publicly. Their stories, previously buried by Sacred Heart's legal department, now dominated news cycles. Congressional leaders demanded a full investigation of Phoenix healthcare management. Most importantly, patients' families began speaking out about loved ones who died after receiving unnecessary treatments, about bills for procedures that were never performed, about a healthcare system that had prioritized profits over human life. Federal agents raided Phoenix healthcare facilities in 12 states. The company's stock price collapsed as investors fled. Congressional hearings expanded to examine the entire private equity healthcare model. Maya watched from her apartment as Mayor Hoffman announced her resignation, as Sacred Heart's board of directors was replaced, as medical schools began requiring ethics training specifically addressing sexual assault and financial fraud. But the real victory came 6 months later. Maya stood in the conference room of the newly established Healthcare Justice Initiative, an organization dedicated to supporting assault survivors in medical settings and investigating systemic fraud. The walls were covered with success stories, prosecutions secured, survivors supported, corrupt institutions reformed. Sarah Wu had left federal service to direct the initiative. Elena Rodriguez led their investigative division. And Maya served as their coordinator for survivor outreach, using her nursing background to help victims navigate both legal and medical systems. 18 new cases this month, Sarah reported to their weekly team meeting. The Seattle office has identified a pattern similar to what we found with Phoenix. And the legislation passed last week will require mandatory reporting of assault allegations in healthcare settings. Maya looked around the room at the dedicated professionals who'd chosen purpose over profit. Former prosecutors who'd left corporate law firms. Investigative journalists who'd specialized in healthcare corruption. Nurses and doctors who'd witnessed too much institutional evil to remain silent. Their work wasn't finished, it might never be finished. But they'd proven that even the most entrenched systems of power could be challenged by people willing to risk everything for justice. That evening, Maya returned to her apartment and found a letter that had been slipped under her door. No return address, but she recognized the handwriting immediately. Commander Chen, it began. You don't know me, but I was one of Dr. Castellanos' residents. I watched him hurt people for years and never found the courage to speak up. Your testimony gave me strength to report what I saw. Thank you for showing us that fighting back is possible. Dr. Jennifer Walsh. Maya smiled, tucking the letter into a folder with dozens of similar messages. Tomorrow would bring new cases, new challenges, new opportunities to dismantle systems of exploitation. Traded combat fatigues for business suits, but the mission remained the same: protect those who couldn't protect themselves, hold the powerful accountable, never surrender in the face of injustice. Outside her window, the city lights sparkled like stars. Somewhere out there, other predators were exploiting their positions of trust. Other victims were suffering in silence. Other institutions were prioritizing power over people, but now they knew someone was watching. Someone with the skills, the determination, and the network to bring their entire corrupt system crashing down. Maya Chen had found her new battlefield, and she intended to win.